welcome to our growing membership. As you know, SJCA is trying to build a more inclusive cultural community and is targeting its outreach to nonprofits, artists, artist collectives, and tradition bearers of color who help make our community so vital. So if you're joining us for the first time, welcome. You've come to a great session on a topic we can all get excited about, reopening. We've all pivoted to online programming. In fact, attendance has soared for SJCA, and we'll probably keep some of our programs online. You probably experienced the same thing, but we've also seen amazing creativity in our community and engaging audiences in alternative ways. However, reopening can be a little daunting with bringing staff together safely, bringing an audience into your facility, and knowing what audiences are expecting of us. John McEwen has been an extraordinary leader by commissioning research and seeking expert advice in how to move forward. I've heard him talk about how well he's taken care of his theaters and thought his information was important to anyone that is reopening. So we brought him in today. I'm so grateful he generously agreed to share his knowledge with us. Let me tell you a little bit about John. Since I started working on a statewide level in 2003, I have known John as one of the New Jersey's top professionals in our field. John currently serves as executive director of the New Jersey Theater Alliance, a service organization for the state's 40 professional theaters. You may know him from statewide meetings or his visits to South Jersey to present ADA workshops. John is the founder and chairman of the Cultural Access Network Project, a program of the Theater Alliance, as well as the New Jersey State Council on the Arts. The Cultural Access Project assists the state cultural organizations in making their programs and services accessible to individuals with disabilities. Even before joining the New Jersey Theater Alliance, John was the fundraiser extraordinaire. John was the VP for development at the New Jersey Network Foundation, where he was responsible for a $7 million annual fund. Before that, he distinguished himself as director of development at Paper Mill Playhouse, where he implemented the theater's award-winning access services and raised $3.5 million for their annual fund. John serves as a trustee for Art Pride New Jersey, Center for Nonprofits, Montclair State University, College of the Arts, and the Fund for the New Jersey Blind. Without further ado, I give you John McEwen. John, do you want to join us?
Thank you, Karen. And so great to be with you all. Thank you for that nice introduction. And I recognize several of you. So nice to see you all and hope you're all staying well and safe. So I'm going to go ahead and share my screen. Okay. So for those of you that may not be familiar with the New Jersey Theater Alliance, just a quick overview. We were formed in 1981 by 5 professional equity producing theaters at the time. George Street Playhouse in New Brunswick, McCarter Theater in Princeton, Paper Mill Playhouse in Millburn, the Shakespeare Theater of New Jersey, which is in Madison, and the whole theater company, which was Olympia Dukakis, you might recall. They were in Montclair, and unfortunately that theater is no longer with us, but they were all a part of coming together to see how they might be able to work together. And from just a very informal gathering, the Theater Alliance has grown substantially. We were the nation's first statewide service organization for theater, and today there are only 2 statewide service organizations for theater, Michigan and New Jersey. So just some services of the Alliance. We offer a lot of marketing support and audience development through our website, our e-news, our cultural access calendar. We have a statewide celebration of theater in our Stages Festival. We do a lot of networking and professional development with roundtables and field calls. Just a real quick plug for our upcoming EDI symposium. So save the date. Announcements will be going out any day now, but it is scheduled for April 22nd and April 23rd. It will be virtual to assist our field as we're all learning to be a more equitable and just cultural community. And we're proud to be partnering with Art Pride on this event. So more to come on that. We offer a lot of board and staff support for our theaters, individually and collectively. And of course, as Karen mentioned, I think a lot of you are familiar with our Cultural Access Network. And what I'm going to talk a lot about today is the work that we've been doing with our reopening committee and our medical consultant. And these are just some other quick services that we offer. A lot of mentoring, very similar to a lot of the services that you're getting from the South Jersey Cultural Alliance. So let's just go right into how we as a service organization pivoted just about a year ago. When the pandemic hit, we really felt it was really important to have as much consistency and learning amongst our field right away. So we knew that a lot of our audiences and artists are going to multiple theaters. They're visiting multiple theaters as audiences. Many actors and other theater professionals are working at more than one of our theaters. So we thought it was so important to have some consistency. So we brought together 75 colleagues that represent various departments at our theaters, as well as our presenters. We brought in some presenting organizations as well. And we set up some subcommittees in the areas of education, management, marketing, operations, and production. And this has really become a great peer-to-peer learning opportunity. We meet monthly, and then in between each of the meetings, these subcommittees are meeting, and they're sharing information with each other, and they're developing policies and procedures and protocols that they can be shared across the board. And that we are finding really, really helpful. For example, the production, I think many of you know Kevin O'Brien. So he is the chair of our production subcommittee. And what they have done is all the production folks from the various theaters have gotten together and they've pulled best practices that they're all doing. And they're very close to creating a handbook of best practices as it relates to production and how production teams can work in this new world that we're living in. And it's going to live on our website, but I'm happy to share it. I'll be sharing it with the whole field. But that's just one example of the work that these subcommittees are working on. Our education, they've also come together with a handbook that they're going to have with regards to how best to do summer camps and classes and workshops, how best to communicate with parents. So this is all going into documents that can be shared amongst multiple organizations. So for the past, since last spring, we're brought into an international study, getting a sense of audiences' perceptions and attitudes about returning to the theater post and pre and post COVID. So as you can see here on the slide, there are many communities around the United States that are part of the cohort. And then we have some international cohorts, Norway, Australia, Canada, Ontario. So this has been a wonderful, not only are we getting information in our local community, but we're getting information from our regions across the country, as well as what some of our international partners are doing as well. So I'm going to share with you just a couple of things that I think you might find of interest from this study. So we started the study back in June, and it ran for 5 months until November. And as you can see, in the past, there were many questions on the survey asked. These went to the patrons of our theaters that were in the cohort, and surveys were deployed on a monthly basis to different segments of their patron base. So in the past 2 weeks, did you do any of the following activities in person, not online? So as you can see in June, more than 90% did absolutely did nothing. But as the months went on, they started to do, that went down a little bit over time. But what you can see here is that from June until November, there was more confidence in going out to restaurants. So there started to be some kind of familiar comfort level in eating out. Now, if you notice, these went up specifically, especially in our August study and in our September study, because we were dealing with nicer weather at that point. They started to go down a little bit in November, but also keeping in mind that's the colder weather at that point. So we started to see a decline there. But it's really interesting. We asked about the percentage of people who are making firm plans to go out and attend an actual live performance. And these have not, in the 5 months, they never got out of the single digits. So we found that really interesting, because there was a lot of events that were done actually outside, as you noticed. In the summer, we had many organizations doing outside events, but these just never really got out of the single digits. So there's a more comfort level of them going to a restaurant, but actually attending a live theater event or arts event, that, as we see here, that was actually maintained a small percentage. Under what conditions would you resume attending arts and cultural events? So as you can see here, a good number of people right in here were not in the foreseeable future. So that hovers around 30 to 42%. After I've been vaccinated, that started to, as you can see, it was 15%, 14%, and then it started to decline here. And again, notice that it started to decline really in the winter, when we started to enter the winter months, November and December. So there was a lot more, I think at that point, people were still unsure about the vaccine. It's certainly not, we don't have the information as we do today. So I think some of that uncertainty as we headed into the colder months certainly is why we're seeing a decline over here. And then when rate of infections, of new infections starts to drop. And we're seeing that, that also slightly declined. We're actually going to be doing a new survey in phase 2, and we're going to be learning a lot more about their comfort level around vaccines now that that information is out. And I think these numbers are probably we're going to see pretty much some drastic changes here. These are the New Jersey theaters. So as you see, testing and treatment, when testing and treatment is readily or broadly available, 37, 45, that's when folks are going to start to think about going back. About 13 to 28% of those surveys say that they paid for the digital content in some fashion. But another 30 to 40 watched digital content and did not pay anything. But as you can see, digital content is still relatively new to people. So there's a lot of folks that completed the survey that did not watch any online content, but it did start to go up a bit over these as we went further into the months of the survey. Two-thirds of those surveyed really did not care if the digital content was locally produced or not. There was not really a preference. So that's in these large orange boxes, where around 11 or 12% preferred online programs that represent the work of theaters and arts groups in their local community. The biggest problem that a lot of people indicated on the survey was watching online arts activity at home was, they tend to get easily distracted, but also just the technical setup in order to get the full cultural experience. If you're watching it on your phone versus watching something live, of course, it's very, very different. So we wanted to find out how people were watching their online content. Most of them were on computer screens and using computer speakers. So that's the biggest percentage down here. A few in this green box here, these are the folks that are watching it on their large screen televisions. Some, and then the blue here, a few are watching it on their mobile devices. But I think what's interesting is these haven't really changed that drastically over time. So you would think as time goes on, people might become more comfortable in the online content, but it's still an area that folks need some assistance with. In fact, I was just on the phone with George Street, and their patron office, their box office, is flooded with calls on how to use online content because they're streaming a show right now. And so depending upon one's comfort level is what you're gonna go on, you're gonna make the decision to go on or not, or what is the device that you're gonna use to get your online content. So according to Pew Research, right now it's about 60% of Americans say that they will get vaccinated. So there's still, as we all know, there's still a large percentage of our population that is not, that doesn't believe, that is not pro-vaccine. But I will tell you, several months ago, when we first started this study, it was at a low of 51%. So we have seen a growth in comfort level as people are getting more and more information around the vaccinations. But what the really good news is that only 2 to 8% of arts patrons won't get vaccinated. So the folks that are attending our events, they're, for the most part, they're all pro-vaccine, except for a very small percentage. And that hasn't really changed. As you can see, over the months that we asked this question, we didn't really see too much of a change. A little bit in November, we saw here, but not too much of a change. In New Jersey, these are, with some of our other cohorts, but in New Jersey, it was 4% of the arts patrons in New Jersey were not comfortable with vaccinations. So that's actually very comforting. So it's just important, I put this up there, that you want to remember back when the polio shots were being distributed, there was a lot of trepidation back then. And Elvis did a whole big campaign to give people a comfort level in getting vaccinated. So there's been lots of conversations on what can the arts community do. And Alan Brown, who works with us on this audience study, he has stated that we're actually in a very unique position as arts organizations in terms of being able to identify perhaps some individuals that might want to do some kind of education and awareness campaign around the safety of vaccinations, but also how can theaters and cultural organizations utilize opportunities for education. I know some theaters are speaking with their local health departments about being venues for vaccinations, utilizing lobbies. So there are ways that the arts organizations can actually help during this time. And just from a whole press perspective, that would be actually a wonderful public relations campaign to get the word out about the importance of vaccinations, but also that our cultural communities are partners, and it will start to lay some foundation when it is time for us to reopen, that we've begun some of those interactions and educations with the public. We're working with a gentleman, Dr. Stewart Weiss. He runs an organization called iCrowd. So Dr. Weiss is a medical professional who's worked with a lot of organizations on emergency medicine and safety measures. So the Thanksgiving, for example, the Thanksgiving Day parade in the city, they hire Dr. Weiss for all the safety measures and crowd control. He's done it for the Super Bowl. He's working very closely with Screen Actors Guild as television shows are going back to filming. He's providing them with all of their guidance and protocols for safety. So we did a webinar with Dr. Weiss back in March, and was so impressed with all of his knowledge that right then and there we contracted him to work with our theaters. So he's our medical consultant to not only, to the Alliance, but he's the medical consultant to all of our theaters. And he participates in all of those reopening calls that we do with our colleagues. And he provides guidance on policies and procedures, signage and messaging. He'll not only provide guidance just generally, collectively, but he has taken the time to read individual theaters' policies and procedures and provide them with some really great feedback. In fact, some of you might be joining the Discover Jersey Arts webinar tomorrow afternoon, and we are going to be talking a little bit about messaging. And I have asked Dr. Weiss to join us to give us a little bit of a medical update, but also he'll be part of this conversation around messaging, because we do believe the more consistency we can all provide, the better it's going to be in providing a comfort level, not only for our artists and staff, but certainly for our audiences. So some things that we've learned as we've moved forward in communicating with Dr. Weiss on how best to communicate with our patrons, because we're all starting to think about what should our messaging be looking like, and what should we keep in mind as we're coming up with a communications plan. So number one, and we learned this from our Alan Brown, that audience study, people want all of us to be transparent. That's number one. They want to know that your facilities are being cleaned, how often they're being cleaned, what company you're using. That has maintained in the months that we did this audience study. That particular interest, always about 52 to 54% of people completing the survey, this was their number one concern, that they wanted cultural venues to be transparent. Dr. Weiss also says when you're communicating medical information, you want to speak to your patrons as if they're at a 6th grade level. He said you want it as basic as possible. You want it repetitive and in multiple places, websites, lobbies, etc. But you want to make it very, very simple. No, don't make it too complex. Make it easy. And he said, just keep in mind, as you're putting together your messaging, just do it as if you're speaking to somebody at a 6th grade level. Consistency and clear messaging is important. And that's why we all feel that the more that our cultural community can be consistent in how we're sharing information with the patrons, the better it's going to be for all of us. And it's going to give that real comfort level to those visiting our venues. We talked about the importance of safety symbols. So a lot of organizations have put up some symbols, but some of the symbols are dreadful. You know, the mask doesn't really show how to properly wear the mask, you know, over the nose. Hand washing, distancing, protection. If you have a box office or an information booth, there's going to be some protection there. There's symbols for that. So part of our call tomorrow with Our Pride and Discover Jersey Arts is going to be talking about the importance of consistency with safety symbols. We would love to come up with symbols that all of us throughout the cultural community, much like our access symbols that we talk about, that everybody use, we want to, hopefully, it would be wonderful if we could come up with the very same thing as it relates to the safety symbols. So again, the more consistency we can provide and clarity, the better it's going to be for our patrons. He does suggest that when we think of signage, that we try to separate it from the brand of our organizations, because he feels that it would probably blend too much into other signage that you're offering, and the safety signage or that important information you want to share with your patrons might get lost because it's all blended together. He feels that it's really try to make it as clean as possible, but not have it so brand focused. He feels there's a chance that could get overlooked. And he does believe that this work, and as you think about your messaging and how you're communicating to your patrons, to your artists, to your vendors, to your staff, he believes it's an organizational priority that you work on this as a team. So each department should be involved as you're thinking through these things for your organization, not just one particular department or one person off on their own, because you want consistency in each of your areas of your operation. So we've been working with an organization called National Restoration. They're in Cherry Hill. And so one of the things that our theaters were most concerned about is they wanted to make sure that their venues were being cleaned and sanitized appropriately. So we formed a partnership with National Restoration, who's gone into cleaning some of our theaters. They have trained a few of the theaters' house staff, or maintenance people, I should say, on how best to clean and sanitize. We also have equipment. We worked out a deal with National Restoration so our theaters could get a discount, but we also provided a mini grant program to give some financial, though it's small, some financial relief to our theaters to purchase equipment. So we got a grant, and then that grant allows us to help pay about $1,000 worth of disinfecting equipment and supplies for the theaters. And most of the theaters have taken advantage of it. So right now we've probably supported around $15,000, $18,000 back to the theaters for them to purchase supplies. And we're looking for additional funding so that we can continue to support the theaters as they look at these additional efforts. Because as we all know, our budgets are now having line items that we never thought we would be adding. And it has, this is definitely an additional expense. So where we can provide some relief, we want to do that. One other thing that you might want to give some thought about is we established a theater worker relief fund early on to help some of the theater workers affiliated with our theaters get through the tough times with some small grant. The theaters identified those workers, and we were able to give them $600 in grants so that they could pay rent, put gas in their car. But we just got another grant from another foundation, and what we're going to use that for is the theaters, again, will identify a theater worker affiliated with their organization. But a lot of our theaters now, and I think all of you are going to need to start to think about this, is you're going to need to identify a COVID compliance officer, because if you're welcoming people into your facility, you're going to really want to have somebody who's going to manage that whole process. If there is a problem that comes up, you don't want necessarily it to be the house manager or somebody who has many other duties. You want it to be somebody that has been trained, that can be your COVID compliance officer. There is some training, and in fact, Dr. Weiss is actually planning a webinar around training for this very thing, and hopefully he'll have his curriculum all set in the next week or so. I can certainly share that with all of you if you want to listen in on that webinar. But it's something important that you should all be thinking about, is that COVID compliance officer. And they do need to have some kind of training. And there are some different training opportunities out there. So this Theater Worker Relief Fund in this phase, each theater can identify at least one worker, and they can put it towards the salary of their COVID compliance officer, or they could put it towards training, because they want to train somebody to be so that they have the those skills to be a compliance officer. We're finding that a lot of stage managers, for example, they're becoming and getting trained to be compliance COVID officers. So, but you do have to go through some training. So I can share some of those, Karen, with you, some training links, but also I'll keep you posted on this webinar with Dr. Weiss. And in fact, when I chat with him tomorrow, I'll find out where he is on the curriculum, but it should be ready in the next couple of weeks. So I'll be sure to keep you posted. So I know this is a lot of information, but I just wanted to give you some very quick highlights on some of the work that we've been doing, some of the ways that we're partnering, not only with our colleagues, but with other organizations to ensure that we're staying connected, providing some uniform and consistency moving forward, so that when it is time to reopen, we have a foundation and a peer-to-peer knowledge. So it's going to be best for all of us. I think we're going to be learning from each other for quite some time. I think next year probably will equally be as challenging. We're not going to just open up our doors and turn on a switch and be back to normal. So I think the importance of the peer-to-peer information and really trying to develop as much consistency as possible, I think is going to be key in bringing comfort level to everyone that we, our organizations are working with, from our audiences, our artists, our vendors, our staff. So I look forward to chatting today, but also as a field that we're continuing to learn from each other. I'll be happy to answer any questions or just be part of some good conversation.
A couple of people did list questions in the chat box. If you have questions, that's one place that you can list it, or you can raise a hand, real or virtual, and we will get your questions and funnel them through to John. So John, I'm going to send you a couple of the questions that we have received so far. Do you see them in your chat box?
Yep.
Okay, great.
Let's move up. It was asked on they were commenting on the technical ability quality of the organization. So somebody asked about the subpar technical setup. It was the technical ability and quality of the organization. So somebody just wanted clarity on that.
Thanks, John. That was me, Michelle.
Hi, Michelle.
Hi, from the State Arts Council. I think from my perspective, and the councils, we were really interested to know, because for some, a lot of organizations, doing productions virtually is not something they might have been thinking about or doing in small bits. And if you're thinking all virtual, especially large productions, there is a large price tag that comes with having the right equipment to do quality productions and streaming online. So we're also curious not only on the user's end, and that's such great information that Wolf Brown captured as far as the devices the audience is using, but also what are the abilities and or needs of the organizations who are now finding themselves streaming and putting more in a virtual world.
Yeah, I can tell you several of our theaters have asked for us to think about setting up some kind of a fund for some equipment, because now the virtual part programming is not going to go away. There are silver linings, I think, that we've all found, is that people are tuning in from all over the country and sometimes all over the world. So what's great is that geography barrier has been broken down. It's also from an accessibility perspective, more and more people, especially those with hearing loss, are really benefiting, since I would have to say about 90% of the virtual programming is being captioned, and it's a reasonable expense to do that. So I think the more sophisticated our theaters get, the better, because they also want to make sure the quality of what they're presenting meets their high artistic quality, right? If you were to come to their venue and see something live. So, today, the box office at George Street said that they were just overwhelmed with calls, and it doesn't matter how old a person is, just to get the technical support so that they can view the theater's performance correctly. And a lot of them are buying smart televisions. So George Street said that of the calls they got this morning, 12 people said they got smart TVs so that because they want to watch more virtual programming, but they want to watch it off of their computer for the quality. So I think we're all learning, our audiences, as well as we as providers are all learning this new world, and it's not gonna, I don't think it's gonna go away. I think we're gonna have a hybrid of programming. So in order to attend tomorrow's program of Discover Jersey Arts, it starts at 3 o'clock, and you could probably go on to the Art Pride website, and you should be able to see it there. It's a DJA webinar, and I believe you would be able to register that way. If not, you can contact somebody, Jim Atkinson, or a colleague in the Art Pride office, and I'm sure they can send you the information.
I did also put links in the chat box. So if you're interested in the webinar, the shorter bit.ly will take you right to the registration. The Art Pride will bring you to the page that describes all of the Art Pride webinars, including the one that's being hosted tomorrow.
I just signed up using that link.
Oh, perfect. So somebody is asking about what considerations to apply for outdoor venues and how they differ from inside. So not to put Steve Steiner, because I just heard your voice, Steve. Oh, I'm moving my box and now I see your face. So there you are. Hello, Steve. You might want to talk just a little bit about the considerations in the outdoor performances that you did last summer in the park. And I can send you all, Karen, I will send you a link. We did do a webinar on producing outdoor events 2 weeks ago. a conversation with, for our members. And it was the Shakespeare Theater. It was the Barter Theater in Virginia. They took over an old drive-in. So they had an interesting story. And then the Berkshire Theater Group, Nick Palaiologos's organization. And it was an interesting conversation. And I think you might all find that of interest. So I'm happy to send that link, the recording over to Karen, and then she can send it out to all of you. But maybe Steve, you could take a couple minutes and just talk a little bit about some of the considerations you had to think about when producing outside.
Sure. Vicki, what kind of thing are you trying to do outside?
Basically, these are amphitheater performances. In one case, something called the Music Barn, which is a little bit less sophisticated, but basically, lawn seating or table seating, but out of doors.
Okay. Well, what we did is we erected a 50 by 100 foot tent and built a stage, put in a lighting rig and truss, and brought our spotlights and our sound system outdoors under the tent. It had a fence. I think it was about 6 feet beyond the perimeter of the actual tent, so that we had privacy screen on the fence, so that people couldn't just like stand there and watch unless they were really tall. That was all the way around the perimeter of the space. We had seating. The stage we built was like 16 deep by 30 by, well, it was 50 feet wide, but it was 35 because we had wing space on either side. And then we had it 3 feet tall, so that with the flat seating, everybody would be able to see everybody on stage without having a head in their way. We put all of our tech in the back. The stage manager, the lighting, and sound was all the way in the back. The seating it really varied depending on how tickets were purchased, how many we could seat, because we would seat individually for every performance and changed the seating for every performance. Now, I know that the Shakespeare Festival set up pods where groups of ticket buyers could be in these outlined pods that's on the ground, and they were spaced properly. So that's how they did it. So that didn't change. They just assigned groups of ticket buyers to pods. Ours, we did like 4 chairs, and then 6 feet, and then 2 seats, and then 6 feet, and then one guy by himself, and then 6 feet, and then 6 feet back for the next row. It was 13 rows of seats that we were able to get in, and we could seat between 175 and say 210. When people bought tickets in 1s and 2s, it was a lower number than if people bought tickets in 6 and 8s. For instance, we did a children's theater of Frozen Junior, and we had a lot of 6 and 8s and even 10s. And we got 228 in that particular configuration, which was still below the maximum for outdoor groups in New Jersey. It started at 250 and then went to 500. So we were still under that maximum amount of groups. You have to consider whatever the governor is stating you're allowed to do. And that changes seemingly weekly. But the changing of the seats, we got a pretty good format together, and I just set it up really in Excel, and was able to usually set up the seating for a performance in about 45 minutes, and then our ushers could take and follow my map and just do it. But that was the most labor-intensive part of it, because we did 7 main stage performances, 5 children's theaters, and 2 concerts at least every week. So that's 14 performances that we had to change the seating for 14 times every week. but people loved it. And at the beginning, it seemed like everybody was waiting for someone else that they knew to already have come and tell them that they felt safe doing it. So as the season went on, it got more and more popular, and we were doing very, very well toward the end of the season and had very, very small crowds at the beginning. But that portends well for this year because we think we're probably going to have to be outside again this year. Advanced sales actually just kicked off a couple of weeks ago, and they've been not like they would be if we had our regular theater without the pandemic, but they're doing very well, you know, and we feel like it's going to be a reasonably good season, and at least maybe getting to break even this year, which of course we didn't last year, but we knew that. If there's specifics that you need, Vicki, you can email me and I'll be glad, or call me and I'll be more than happy to go over more specifics, or if anybody else does too, because we actually did have a lot of experience with it last year and learned a great deal. We also did some indoor at 25% in October and December, and this last week. We also had a couple of shows. So yeah, I'd be glad to talk with anybody about that. And I'll send you over my number now, Vicki.
Thank you very much.
Of course.
Thank you, Steve. Steve is a board member of SJCA and is very generous. So if you do need him, please do get in touch with him.
Yeah, actually, I'm also on Art Pride board.
And I can send you, if you all would find it useful, I can send you the full slide. I just shared a very few slides of the findings from that audience study. I mean, I can send you all the slide deck of the final. And I think to peruse it, you just on your own, you just might find some of the information useful. So I'm happy, again, I'll send that over to Karen along with the link to the discussion we had on outdoor events.
And I'll include all of those links and contact information in the follow-up email to the event with the recording, so everyone will have it all in one place. And we had one other question come in, asking if the outdoor parameters may change by this summer.
I would say yes, more than likely. As Steve said, yes, you're going to see more changes. Certainly, I think we're going to learn a lot in the next 2 months or so. As more vaccines become available and are distributed. If the cases, they just did an increase for indoor arenas. The governor just, if you have an indoor arena, I think of 5,000 seats or more, I think you can have, I want to say it's 15 or 20%. So that's like, you know, the New Jersey Devils are very happy. So if you're a hockey fan, you're going to have an opportunity to go to a Devils game. But that was just announced this just a couple of days ago. So I think you're going to, you know, begin to see more, hopefully, you know, some things loosening up a bit. But as Steve said, it's always always changing. So.
Okay, we're approaching the 2 o'clock hour. I don't see any other questions coming in, but if anyone has one, oh, one just came in here. Can you see any comments on pricing differentials? Is it wise to offer comeback discounts, or does it undermine the safety message?
Steve, you want to, I can tell you just, I mean, it's been a little all over the map in terms of how theaters that I've heard from, how they've been doing their pricing. Certainly things are not at the level that, the pricing level that they were traditionally. Some people I know, for example, Paper Mill as one example. They're keeping all of their virtual programming and everything now is strictly for their subscribers, because they have a large subscription base. A lot of their subscribers forgave their subscriptions. They want to maintain them. So the virtual programming that they offer, they're only offering it to their subscribers, much like like a loyalty program, in the hopes that they'll be able to that they'll renew again next year, and that's a very loyal audience. So that was a decision. They're the only ones I know that have done that. They're not inviting the general public into their virtual programming right now. So I think it does run the gamut.
Yeah, with the live, a lot of people are surprised that because our capacity is like half of what it normally would be if we're outside, and it's only 25% inside. People are surprised we didn't raise prices, but we specifically didn't raise prices because we really wanted to keep, everybody not thinking we were taking advantage of a difficult situation and trying to take advantage. We wanted to keep our patrons, but we're not doing any streaming. I understand that if we were doing streaming, there might be a reason, because that I believe should cost less than a regular live ticket, because your potential audience is much larger.
Yeah, most of them are definitely decreased. They're $15, they're $25. 25, I have to say, is probably the most popular price point that a lot of the theaters are offering their streaming programming.
Okay, any other questions? This would be the time. One more we've got coming in. How did you handle social distancing and masks for your actors?
Well, interestingly enough, because of where we are on Long Beach Island and not having the talent pool that's available to theaters in larger communities like over near Philadelphia or up in North Jersey, we have housing here for 55 people. So we actually asked everyone to buy into the concept that we were going to create, a bubble like the NBA, kind of like a poor man's NBA bubble, all the separation and none of the perks. So we just asked everybody to be really, really only amongst each other, and we were tested every 2 weeks, it was 100% COVID-free. People really respected not being with people outside of our bubble. And so we didn't need to have social distancing on stage, although nobody touched anybody else at all during on stage. And we also had really protocols with regard to props and what have you. We didn't have any touching, but we didn't have to do like 6 or 10 feet with plexiglass in between the actors, because they were their own bubble, just like the NBA players who were constantly bumping into each other on the court.
Any other questions before we wrap the session for today? Okay, well, just one little bit of housekeeping before we say thank you to John, and thank you to Steve too for filling in some information as well. I am going to be putting a link in the chat box to a survey, so you can tell us how the session was for you today, if it was relevant. Please fill out the survey when you get a moment and let us know how we did. Thank you all for coming today.